officials have called for non-emergency surgeries to be postponed amid the pandemic, allowing hospitals more space to care for people with the virus. Here to talk more about this is Dr. Adam Schlifke. He is an anesthesiologist and assistant professor at Stanford. Doctor, tell me why it's important for these types of procedures to be halted.
Yeah, hi, Heather. Thanks for having me here. This started as just an idea about 2 weeks ago. I have to be honest, the writing has been on the wall for quite some time that we were going to be faced with a surge of the pandemic, as we've seen that many hospitals throughout the country have suffered as a result of being forced to deal with this influx of patients. And at the same time, many hospitals in this country are still conducting operations sort of business as usual. And part of that is doing operations that are completely elective. CMS has recently come out with guidance that has recommended that most of these elective operations are not done. Unfortunately, because of the way that hospital system reimbursement works, it's not necessarily in a hospital's best interest to stop these elective operations. And so many anesthesiologists, I'm an anesthesiologist, I'm part of a national association of anesthesiologists, the ASA. Many of the providers of this group had to deal with this conflict where they don't necessarily feel like they're supported by their administrators. They are trying to do the right thing, but at the same time, they're putting the patients at risk and their own health at risk because they're taking care of patients that may be asymptomatic. And at the same time, they're having surgery, and those patients may suffer as a result.
Mm-hmm. And doctor, isn't this also a supply issue here, in that if you have doctors and ventilators and equipment going to serve those who are undergoing elective surgeries, none of that will be available for those COVID-19 patients?
Yeah, that's exactly right. That's where all this came from. We have actually built a grassroots movement. In 2 weeks, we probably have a team of about 50 people that are working on, in real time, converting space within the hospital and surgery centers into critical care areas. It's a very possible thing to do. It's never really been done before. So we can take operating rooms where a completely elective surgery is done, and we can convert those operating rooms into critical care areas. Because what do we have in the operating room? We have equipment, supplies, nursing staff, talented anesthesiologists, and then even more importantly, not more importantly, but we also have anesthesia machines. So those anesthesia machines serve as ventilators. So, for instance, some people are predicting that we will need 1 million ventilators over this pandemic, and the U.S. only has 150,000 ventilators. So where are those 850,000 ventilators are going to come from? They can come from the operating rooms. They can come from other areas of the hospital that are potentially providing anesthesia services, like the endo lab, the cath lab, the interventional radiology lab, and they can come from the surgery centers. There are 5,000 surgery centers in this country. There are another 20,000 anesthesia machines in those 5,000 surgery centers. So we could tomorrow we could increase the capacity of our ability to take care of these critical patients by at a minimum of 20,000 and probably many more than that.
Well, that certainly is an impressive statistic that you're giving. We'll have to wait and see if hospitals here in the Bay Area and around the country, in fact, do decide to postpone these elective surgeries. Doctor, really appreciate your time. Thank you.